I know that we kind of had the green light to go ahead and get back to work. So I'm happy to see that there's about 100 and 135 people here now. I was expecting to lecture to about 5 people. So this is very nice. And again, big shout out to Dentistry Academy and the guys, and Amity Management, Amity Technologies for doing a lot of the behind the scenes work as well. And yeah, of course, Zoom brought us together as well. And maybe they'll see this and sponsor me, you never know. So, I mean, before the pandemic all started, this is kind of what my world looked like. And I had my main practice running. I had Parkview Family Dental running as well. We were just getting that off the ground. Mill Street Family Dental is a startup that it's still in construction right now. It's supposed to be done by now, but as we know, with all the delays, that didn't happen. And in the middle there, you see our floor plan for a new office that we're doing, and that's slated to be done probably sometime in the fall or so. But who knows with all the delays, but we'll see. And a lot of people have come up to me and asked me, are you still going to be doing all this after this whole mess of a situation? And my answer has been, this hasn't changed my mindset. This hasn't changed my mentality. I see this as an opportunity to keep going when maybe a lot of other people wouldn't want to continue. So I definitely see this as an opportunity. Us as a profession, we're going to be more than fine. We're going to bounce back really quickly. You'll see. And then this came, right? The pandemic, right? And like I said, we're all going to be okay. We're going to be totally fine. And if anybody's, extra worried about it going in, I'm going to address a lot of that today, but I'll have my email, my number at the end, and you guys can reach out to me anytime. For those of you who hadn't seen it, this is one of my talks, my first talk. Vic Jindal, he asked me to speak at one of his events, and yeah, Vic is he's a good guy in the sense that he just got a special ability to bring all us dentists together. And that's my initial talk. You just go on YouTube, search up Jindal Financial Group, and you could see me there. In January, before everything went all weird, that was my talk at Dentistry Disrupted again, one of Vic Jindal's events. And that's up on YouTube as well. You just search up Dentistry Disrupted. And my goal today is to give you some new information. I don't want to give you the same presentations. So if you watch those 2 presentations and this one, it's pretty much everything that I would have wanted to know coming out, and plus a little bit more as well. So I'll make it worth it for you guys who are watching me today. And a lot of people ask me after those events, I get the same question a lot. It's, what's the secret, or what's the one thing that I can do to be successful? And there is no one thing, and there are no secrets, and it's not one thing, it's everything. And success is just doing a lot of small things really well. And that's my goal today, to give you a lot of small things to work on. If you even just do one of them, it'll help. But if you do more than one of them, you'll see it has kind of like a compounding effect, and it snowballs on top of each other. So let's jump in, right? I know a lot of you are thinking, what should I focus on right now? And I say, it's weird, I know, but try to enjoy the time off, because you'll see once you graduate, I mean, I've been up for a little under 2 years now, but it feels like 2 months. And I know a lot of the, more seasoned dentists here can probably say that 20 years feels like 2 years. And so your life gets pretty chaotic once you graduate and dive into dentistry. So right now, I mean, just try to enjoy the time off, pick up some hobbies. And this is one of probably the only times we'll get this opportunity. We have no shortage of webinars, of course. I know everybody's kind of all webinared out by now. And again, but we have the Dentistry Academy on YouTube. We have Dentistry Disrupted as well. All those videos, including this one, is going to be on YouTube, and they're all free, of course. And the amount of free content that the Dentistry Academy, Dentistry Disrupted has put out is pretty staggering. So big shout out to Vic and Dentistry Disrupted, and to Dentistry Academy as well. Will I be okay post-COVID? That's a main thing that I hear from a lot of, especially new grads, dental students. Will I be okay? And I think a lot of us are thinking about that as well. And so let me just kind of put this into your mind here. So you're already used to wearing all the PPE in dental school, right? We all know that in dental school, you got to wear a hazmat suit basically for every procedure. And you're going to be used to wearing all this. And you have the opportunity to be at a level playing field with other dentists as well. It's a very unique situation. Because when I graduated, I know that I felt light years behind everybody. I didn't feel as fast, didn't feel as efficient. I still feel that way. But now it's like we're kind of all in the same boat. So it's a really interesting scenario. And you could focus on quality over quantity. I'm going to dive into that later as well. But now it's like there's no pressure to go too quickly at the beginning, especially. And you could totally focus on the quality. And going with that, you have a lot more time to hone your skills, like, you know, your clinical skills, chairside manner, everything like that. So, I mean, it's really important. And I'm going to dive into these topics as well. And so, you know, the short answer, yes, we will be okay. I like to put everything in perspective as well. We're not the restaurant industry. Their margins are 5 to 10% if they're lucky. And a lot of them have to shut down. So we're in a very, very good situation as dentists. All right. So I'm jumping in here. What to focus on? So looking for a job, right? That's important for a lot of people right now. And as you saw in my other lectures, I mean, if you haven't already, new grads, now's the time to reach out to your supply reps and see and look for jobs. But I'm sure a lot of you have done that already. And here's a couple things to think about, and a couple things that I wanted to think about. So are you replacing an associate, or are you not replacing one? I know me personally, I was looking to replace an associate, right? Because that way, at least I kind of know that there's an existing patient base for me there. But at the same time, if you go into a busy office and you're not replacing one, don't let it be a deal breaker, because it might be busy enough to sustain you as well. Do you work in multiple offices? You do work in one, right? A lot of people ask me that as well. I personally worked in multiple offices. I started off working 2 days a week at 3 offices. And I totally see the value in that. There are some gem practices out there. There's, you know, one practice, and 4 or 5 days a week, you can be incredibly busy from day one. And I say, if you find something like that, I mean, that's great. That's awesome. And I'd say jump on it for sure, right? But with multiple offices, I like it because you could really condense your days at different offices. So your schedule can be very busy from day one. Instead of having 5 days of not so busy, you could have 2 days of quite busy. And also with that, I mean, you get to kind of see what you like and what you don't like in the offices, maybe from a management point of view, or you know, practice management, even different softwares, different staffing. So you can definitely see kind of what you like and don't like as well. Do you work in a startup? Do you work in a new office or an existing office? When I was starting, I wanted to work in an existing office just because I wanted the patient base there. But now looking back, I kind of see the value in working in a startup or a newer office as well. Because in dental school, you see how many patients, maybe 2 to 4 patients per day maximum. In a startup, you're of course going to see more than that, but also now there's not a lot of pressure. You can see, these patients, offer same-day treatment, work on your skills. And I found being in an existing office from day one, from a busy office, it was extremely stressful. A lot of times, you run behind, and maybe sometimes the quality would kind of suffer a little bit as well. How many other dentists are in the office? So let's say you have an office, 1,000 patients and there's 6 dentists. They may not be able to allocate the patients fairly between all 6 or 7 of you. Demographic analysis of the area is important. You got to make sure basically that just the area can support as many dentists as there will be, especially if you added there as well. Also see the schedule. That's what I did. Job interviews. I mean, now I know job interviews are over Zoom now, but you could just even ask them for screenshots of their schedule. What I did is I just looked at their previous, couple months, and I looked ahead a couple weeks as well to see how far they were booked out. Gives you a nice visual representation of how busy an office you're getting into. So switching gears here, let's say you find a job, and now what are you supposed to focus on as an associate? I mean, I know you guys have heard this all the time, right? But quality over quantity, always. Ethical dentistry, always. And again, the reason why you've been hearing this over and over again, and that's the most important thing for us. And let me just give you a kind of an idea here. So let's say you graduate and you see 5 patients per day. Again, in dental school, you're seeing 2 to 4 patients. So this is not many more than what you've seen in dental school. I can guarantee you'll be sitting around a lot seeing 5 patients a day. You're going to be bored. But let's say they each need a DO filling, right? 235 each. Hygiene's allowed back pretty soon, so you're allowed, 5 recall exams, let's say you do. Again, recall takes you 5-10 minutes at a time, so that doesn't really add much time to what you're doing. But even with that day, your total billings for the day will be $1,350. And let's say your 40% associate salary, that's $540. Let's assume you work 4 days a week. You don't want to work 6 days a week. That's totally fine. So 4 days a week, $2,160, $8,640 monthly. That brings you up to $103,000 around per year net. Now, I mean, a lot of jobs don't make 6 figures, and not that we're definitely not better than everybody else, but it's just we're very fortunate to be in the position that we could see 5 patients a day and have a really, really relaxed day, and we could still make 6 figures, right? So it's just so important that to not focus on the money, right? Don't be too money hungry. Don't be worried about being too fast or too efficient when you start. That will come. And I'll tell you that a lot of associates that I know, I mean, they blow that number out of the water and with not pushing too hard, right? Intraoral cameras I've mentioned before, but I think they're quite important. And I mean, Carriere intraoral camera, that's a great one. The DY50, you can get that off Amazon. And I say, if you're an associate and you're in a practice that doesn't have an intraoral camera, just buy it off of Amazon, honestly. So the DY50 is good. The Mouthwatch intraoral camera is good, $299. And when you graduate, of course, you're in a lot of debt, right? I know, right? But if you do 4 fillings, your net profit will be $376 approximately. So if you look at it on like a return on investment point of view, then it pays for itself very quickly. That's just one of the pictures that I've taken on my patients. And it's like, if you have a picture like that, you can really educate them and say, this is why we do crowns, right? So we don't have teeth breaking like this. Same day treatment is a big thing as well. And that's especially important as newer dentists or newer grads, because your schedule might not be as busy as you want it to be from the beginning. And that's okay. That's totally okay, right? But I always say the no-show rate for same-day treatment is 0%. Your patient is already in the office, already in the chair. They've maybe already taken a day off work. They're there, right? You have your intraoral pictures because your intraoral camera, right? You sit them up, you show them pictures, and you x-rays, you explain it to them. And this is what you say. Hey, did you want to get this started today? And you would be shocked the amount of people who, first of all, say yes. Second of all, you'd be shocked the amount of people that don't even know that this is an option to get it done same day. Most patients, I think, are conditioned over the years to, book another appointment, we'll bring you back. But here, you say, hey, you want to get this started today? We'll save you a trip. Moving into case acceptance, I mean, that's a thing that kind of ties into the previous topic as well. Just an aside, that picture, that's my first Sarah crown that I did a couple years ago. So big shout out to Dr. Jeff Sumner on that. I say, I mean, keep it simplified. Offer 2 options at a time. I think if us as dentists, if we know a lot of options in our heads and we present all of them to our patients all at once, it can be very overwhelming. And we really have to remember that patients don't know dentistry like we do. And if you overwhelm them with too many options, you're going to hear a lot of people saying, I'm going to think about it. I need to talk to my spouse. Let me get back to you on that. And we all know what that means, right? We've lost them, right? We've lost them in that sense. So if you offer 2 options at a time, it's easy. They pick one of the options. And if you have more than 2 options, just offer 2, and then offer another one with the one that they picked. It's kind of like a March Madness bracket. This will make sense more on my next slide, but it's a good way of presenting it. So you offer the best option first, you offer cons and then pros. And you offer the second best option next, and you offer the pros and then the cons. And the reason for this is because with the second best option, they will remember it associated with the cons. And again, this will make more sense here. So let's say we're crown versus Mmodbl. This is something that as dentists, this is our bread and butter. We see this every single day, multiple times a day. And so let's say crown versus Mmodbl, and this is how I present it to them. You show the pictures, and then I'll sit them up. I'll say, hey, Mrs. Jones. Everybody likes to say Mrs. Jones for some reason, but hey, Mrs. Jones, we have two options here. You can get a crown for that tooth, and a crown's more expensive. It's about $1,200, but it's the best long-term option for the tooth, and it does protect it from breaking in the future as well. Other option is a filling. Filling's a cheaper option, around $300 to $400 or so. But it generally has to be replaced multiple times throughout your lifetime. And it doesn't protect the tooth from breaking. And if the tooth breaks under the gums, it's very hard to fix. And a lot of times we have to take the tooth out. And this is a shout out to Dr. Mike Ling for this next line here. I say it all the time. I think it's fun. It's such a coincidence. But if you ask my staff, my patients, my associates, I say this all the time, and it helps a lot. If you could afford it, I think you should do the crown. If you can't afford it, we can try the filling. It's a cheaper option. It's not as good, but it's a cheaper option. Either way, I'm good. And important for that is you have to mean it. You have to totally mean that it doesn't matter what they choose, as long as they know the options, and it's totally up to them. It's their decision. And then you stop talking. I think as new dentists especially, we think that sometimes the more we talk and the more knowledge that we give to the patient, maybe they're going to think that we know more and we're more of an expert. But I find that you just keep it short and concise, and then you stop talking, right? You let them talk now. Of course, if they ask something, you answer them. Don't just stay silent, but we got to be short and concise, to the point. Offer specialty services as well. And this is especially great if you're working in 2 or 3 different offices. That's what I did when I first graduated. I just told the offices that I worked at that I was pretty comfortable with surgery. I was pretty comfortable with endo. And I told them that. And you'd be surprised how many principal dentists and associates, they just don't really like doing this. And they don't like sending patients out to specialists. And so you become kind of like a pseudo specialist, like a referral source for them. And your schedule will book up quickly. I know that in my first week of being an associate, I didn't do many fillings. So I was doing mostly extractions and endo. And those, as an aside, those cases, those are just the ones you see in the background. Those are a few endos I did during this pandemic. And then it's a wisdom tooth case I did a while ago. Caveat to this, though, is I'd recommend living close enough to deal with the complications and the post-ops. Let's say you live in Toronto, you work in North Bay and do some surgery there, and patients need you now. There's complications, but you're far away. You can't see them as quickly, and it's not in good taste to just offer that patient to a specialist now, or another associate. You should be the one following up. You should be the one dealing with complications. Care calls, I know I've said this already. This is one of the only things I'm going to overlap with my other presentations, but I think it's super important. And any patient who gets anything done in my office from me gets a phone call from me personally on my cell phone. I'm just calling them to see, check in to see how they're doing and to make sure that everything's okay. They're going to think you're the best dentist ever, and you catch a lot of issues early on as well. And it's a great way of differentiating you from the pack. And focus on this now. Focus on this as you're an associate. Even in dental school, I did it. Dental school, it's easy. You only got to call 2 people a day. And I know what a lot of you are thinking. This is going to take me a while. For me, it only takes me about 15 minutes a day, so it's not that much. Are patients going to abuse this number? I can tell you, no. Your patients, for the most part, don't even want to bother you. They won't even call you, right? I think this is very, very important. New patient calls, similar concept. So you have new patients on your schedule for the following week. You just give them a call personally and just introduce yourself and let them know what to expect and ask them if they have any questions. I can almost guarantee they will not no-show you, and they're going to tell your friends. They're going to tell their friends about you for sure. So what to ask the staff for at the end of every day? You ask them for the call list, right? Call list says, it's a list of all your patients with their phone numbers and what you did for them. That way you can go home and you have that list and you can cross them off as you call. Ask for the production report as well. So for your production report, that's just a way to keep track of finances and to make sure that there's no discrepancies between the amount that you're billing and collecting versus the amount that you're getting paid as well. And what to ask staff for at the end of every week. You ask for a list of new patients on your schedule for the following week. And that's how you track your new patients for the following week to give them a call. So let's say you're an associate for a while and now you're kind of getting the itch to buy an office. And, you know, a lot of people ask me, when do you know you're ready? And I think that a lot of the more, you know, seasoned owners on here, and even people who have kids, I don't have kids yet, but people will ask them, when do you know you're ready to have kids? And I think it's similar here that you don't, right? You don't know when you're ready to buy an office, right? But I always say, this is a quote from Warren Buffett, one of the most famous investors in the world. So be fearful when others are greedy, and greedy when others are fearful. Now, in this time right now, a lot of people are fearful of the future and what to expect in dentistry, but I see it as a huge opportunity. And you don't necessarily have to get into ownership, but this is just a massive, massive opportunity to just differentiate yourself from all the other offices and become a leader in your community. So you can take a screenshot of this, or if you can't get all of it down, just shoot me a message and then I could send it all to you. These are some forums and posts from Dental Town, some threads that I found pretty useful when I was in dental school, and then also when I was like a newer dentist. And I read these and they really help you, and they help kind of change your mindset for ownership. But I mean, the reality, you could read all those and you could read all the practice management advice and get all the kind of knowledge that you want about business, which I recommend doing. But the reality is nothing really prepares you for practice ownership. I felt like I was extremely ready getting into it, but yet I was quite overwhelmed in my first, definitely first couple months of ownership. There was a ton of work to do, and it was a totally new experience. So I say take the leap. Whenever it makes sense for you, nobody can tell you, only you know when you're ready, quote unquote ready, right? And I say start looking early. Start looking early. You'd be surprised how much time it takes to find a good opportunity. And then you'd be very surprised how long it takes to actually negotiate, close the deal. And I've had it happen to me a few times now where we're about to sign on the dotted line, but then for one reason or the other, they back out of the sale and decide to keep the office anyway. And by then you've wasted so much time, so many resources, you've wasted money. So just be prepared for this, and don't be frustrated by it. You know, it does happen. It is what it is. So let's say you find, you know, you're looking for offices now. It's like, what are you supposed to look for in your office purchase, right? And a very overlooked issue or step is that you must be able to at least maintain the existing production of the office. This is really important. A good example of this is because let's say you find an office that's doing $3 million a year, and the principal dentist is doing quite a bit of that. And you buy the office, and then the principal dentist stays on for a couple months, and then he leaves. Now you got to maintain that 3 million mark. And if you don't, you're going to be going into the negative cash flow every month. And we don't want that, right? It's too much stress. Why would you do that? So I'd say the good sweet spot for production, especially as a newer dentist, is look for an office doing around 750 grand to $1 million of annual production. I find that's a really good starting point, and it's very reproducible for the majority of dentists out there. And it's definitely a good stepping stone to even take it to the next level of growth as well. It's really nice if the seller is willing to stay on for at least 6 months. And this is one of the criteria I was looking for when I bought my first office. The main reason for that is because they can just transition you into the office, introduce their patients to you, introduce their staff. They're still producing, right? They're a known producer. So they're still doing work for you, either part-time or full-time, whatever they want. And it just makes everything a lot easier. I've already mentioned demographic analysis, but even with an acquisition, it's important to do one of these and make sure that there are enough people in the area to support the amount of dentists in the area of your office. Is the community growing? When I bought my office in Shelburne, I bought the office when that particular town was the second fastest growing small community in the country. And that wasn't by accident. It's because you know that with the community growing, then you're going to have that many more people to market to and that many more opportunities for new patients. It's nice also if there's only few specialty procedures are done in the office that you can do. And a good example with the one that I bought at the beginning, again, I was comfortable with surgery, with endo, and the cellar dentist, he didn't really do a lot of that, and you refer a lot of it. So as soon as I came in, I mean, my first week was, it was mostly surgery and some endo as well, and not many fillings, but what that did is it filled my schedule from day one. And then it's a great way to solidify kind of your presence in the community and in the office as that person, you know, the person to do that kind of work for you. And obviously stay within your comfort zone. Don't be a hero. If you're uncomfortable with it, there's no shame in referring that patient out because you have their best interests in mind. So let's talk about new patients. Because let's say we buy an office now, we find one, went through all the steps. Now we got to grow this office, right? Got to maintain the patients that are still there, of course, but it's nice to get new patients too. The best source of new patients, word of mouth referrals. That's the best source. Also the cheapest, coincidentally. But a good way to do this is to establish an internal referral program. And this is very easy to do, very easy to implement. Send thank you cards to new patients. That's a very easy thing to do. Doesn't cost you anything, and it just goes above and beyond, and it shows them, hey, thank you for trusting us. I know there are other dentists in the area, but thank you so much for choosing us. We really appreciate it. Ask your happy, not sad, ask your happy existing patients to refer patients. A lot of them have no idea that you're taking new patients. They'll see a busy office, and in their heads, they think, oh man, they're not taking anybody new. But you got to tell them, and you got to ask them personally, and you'd be shocked how many people they don't know, and then they go and refer a bunch of patients to you. When they do that, send thank yous to them, right? To your existing patients who refer somebody to you. They thank you for trusting us with your friend or with your family member. I always say treat your patients well and your staff even better, because that way your staff will take care of your patients as well. Google reviews have been huge for us as well. I find, you know, in this day and age, most people just kind of look on Google, search them up, and then they find the highly rated dentists with the most reviews, most 5-star reviews, and then that's what they go to, right? And again, you can just personally ask happy patients, they got to be happy, and provide them with a link as well. So send them the link, make it easy for them. Because I find if you ask them without sending them the link, it's kind of hit or miss if they'll do it. But if they have the link, then you're most likely they're going to do it. We have a program called Recall Max. I'm not paid by them, but I've loved their service so far. And they send out links to the patients who come to our office and ask them to rate us on Google if they've had a good experience. So we've gotten a lot of reviews from them. Let's say you got new patients coming in now. You got to track where they're coming from, right? And on your new patient intake form, you should have, how did you hear about us? And all the options, right? They can check the box on how they heard about you. And main reason for this is because it maximizes the marketing dollars spent in your practice. Let's say, for example, you send out postcards and all of a sudden you're just getting a bunch of new patients in your office. You're going to think, oh, these postcards are working fantastic. Let's do this again. And you're going to send out a bunch of new postcards. Well, what if those patients were coming from the postcards? What if they're coming just from your internal referrals and your Google reviews? You don't know if you're not tracking it. And if you're tracking it, hey, you know to divert your attention and your finances and money to the things that are working. I want to stress that these strategies are not just for practice owners. It's for everybody, right? And if you develop these habits now as an associate or even as a dental student, like, for example, asking for Google reviews, asking for new patients, stuff like that, it's just going to take you to the next level a lot quicker, and it's going to develop these habits for you. Let's talk about practice builders, right? So we have found an office, we have a bunch of new patients coming in. We need practice builders as well, because these practice builders will make our existing and new patients that much happier and more inclined to refer even new patients to you. So it's a snowballing effect again. I think a very overlooked thing is being able to numb any tooth predictably. I think that's very overlooked, and we're going to dive into that. And have a sequence to follow if it's not working, right? And I know, you know, the definition of insanity is doing the same thing over and over and expecting different results. But if we don't know what the steps are in our heads before we get to the procedure or anything, then we're going to be stuck. We're going to be doing the same thing over and over again. Let me introduce you the inferior alveolar nerve block in dental school. And I was there not long ago, right? And I'm sure you guys, a lot of you guys can relate to this. So how do we do it in school? Oh, we give a carpule, start drilling, patient feels pain. I'm not even counting, you know, trying to find your instructor and putting the rubber dam on for an hour, but start drilling, patient feels pain. Now we have an internal panic attack, you know, because hopefully we can keep it inside and not show the patient. So we put one more carpule in and we start drilling again. Patient still feels pain. Now the internal panic attack turns into an external panic attack. And, you know, we need to ask dispensary for more lidocaine because they don't give us enough, of course. They only give us 1 to 2 at a time. And then now we hit a wall, right? We don't know what to do because we're stuck. And luckily we have 3 hours for this in school. But in real world practice, even post-COVID, I mean, we don't have that time. So let me introduce you my way of doing an IA and B in private practice. There are a lot of ways to do it, but this is just the way that I do it, right? So instead of giving 1, I give 2 carpules from the beginning. So 2 from the beginning. I aim high. We all know, like, the higher we aim, the higher likelihood we are to hit the block, right? It's kind of like a mixture between IA and B and a Gauge injection. Go do a recall exam. I mean, even with COVID stuff, I don't need all of my PPE on when I'm giving the injection. I could just walk out and I don't wait for my hygienist. I do the hygiene check when I'm ready to do it. That way I get those, get them out of the way, and then I'll come back and I'll put my PPE on and start working. So make sure the lip and tongue are numb first. Let's say you start drilling and the patient feels pain, which is very rare, I can tell you, if you've given 2 carps and you aim high. It's super rare to have pain, but we need to be prepared for that just in case, right? Stay calm, right? Patients sense fear. It is true. What I do is I just take a short needle, I put articaine, and I do a buccal infiltration on the tooth. And then I just do some mesial and distal papilla infiltrations. And you'll feel back pressure and you'll see the papilla blanch up as well. And then I do some PDL injections, you know, into the buccal kind of furcation area if it's a molar, even mesial buccal, distal buccal line angles. You got to feel back pressure. And as soon as you do all of that, you're ready to start working again immediately because that kicks in instantaneously and you're ready to go. So no time wasted. It takes you about 30 seconds to do that. Endo, I mean, it's a different kind of concept, but I still do the 2 carpules, right? I aim high. This is if you're doing it on let's say a lower molar on an endo or even a premolar, right? And then after my 2 carps of IA and B, I'll do a carpule of buccal infiltration with articaine because the research shows that helps even more. Again, go do recall exam, or you can use that time to set up your rubber dam, files, talk to the patient, build a rapport. And what I do with every endo is I make my access so I just nick the pulp. And what I mean by that is I access so that I see like that I've kind of unroofed it a little bit. I see that little color change. And as soon as I do that, as soon as I see that, I immediately pick up my needle and I do an intrapulpal injection for everybody, every single endo. And you tell the patient, hey, you might feel this for a couple of seconds, but then it'll go away immediately. And always kind of like tell your patient your positive intentions. You say, hey, the reason I'm doing this, just I don't want you to feel pain, so this is why I'm doing it. And as mentioned, I do intrapulpals for every root canal. And I learned that from an endodontist, and it just kind of, we all know that we can numb a tooth and we could even cold test it and it won't feel anything. But as soon as we get into the pulp, something changes and patients will feel pain if we're instrumenting their canals. So this just makes sure that it's going to be an uneventful appointment for you. For upper molar endo, again, that's another one that's common where a lot of people, when they start instrumenting maybe the apical third of a canal, that patients start to feel something, even though they've been rock solid numb from the beginning. So what I do is I give a carpule PSA block, and then I give a carpule buccal infiltration from the beginning. So 1 PSA, 1 buccal infiltration, and again, I do my intrapulpal during my access. And with that, I mean, I rarely have any issues at all. So let's talk about practice killers now. And there are a lot of them, but I find that as a newer dentist, or any dentist really, I mean, the two big ones that I see, and I'm guilty of as well, are not running behind schedule, or running behind schedule rather, and not properly setting patient expectations. So let's dive into those. Running behind schedule, how do we fix that? Seems common sense, right? But always err on the side of booking a little too much time versus not enough, especially when we're starting out. If you think something's going to take you 45 minutes, book an hour for it. I'd rather have a little bit more time and not stress, because in dentistry and private practice, 5 minutes is an eternity. We run 5 minutes behind. The domino effect is outstanding. I mean, we're going to run behind for everybody. We're not going to be happy. Our patients are not going to be happy, and our staff's not going to be happy. It's not good. Efficient local anesthesia. I know I've already talked about local, but this is how important I think local is. I mean, we do this all day, every day. Like most of our day is giving local, right? Huge part of our practice. So we're going to talk about that just a little bit more. I'll always have a game plan as well. I mentioned it before, but have a plan A, B, C, D, E, F, G, etc. in your head instead of having only plan A and plan B. So let's talk about local a bit more. I always tell my patients, you can't be too numb, but you can be not numb enough. I mean, obviously we know that there's overdose, but we keep them under that limit. But yeah, I always tell them you can't be too frozen. And again, that's just telling my positive intentions to them. I'd rather you be a little bit too frozen than have me hurt you. Let's say you're working on top and bottom teeth. A good sequence to do it. We all know top teeth take a little bit, they don't take as long to get frozen. So numb the top first, then numb the bottom, and then immediately start working on the top, because that'll be frozen. It only takes a couple minutes. Then once you're done the top, the bottom should be sufficiently frozen. Your block should have taken by now. Start working immediately. It's a nice uninterrupted workflow. As Dr. Mianquek said, I mean, not every tooth will need local. And we know that, right? We see patients with tiny buccal pit lesions or smaller occlusal lesions, abfraction. They won't all need local. And let's say you're working on a patient who has those kinds of fillings that need to be done, but they also have some that need local. No problem. Just give them the local first, and then start working immediately on the ones that don't need local. Now, once you're done those, your anesthesia will have kicked in by now, and you go ahead and start on that one. No interruption. Let me give you an example of my favorite procedure to do. So 4 wisdom teeth. A lot of ways of doing this. Definitely a lot of ways of doing this, right? Some surgeons like to work on one side and the other, and I've done that as well. But I find one that really works well for me, especially if you're running a busy schedule on top of it, is I numb the teeth in this order. So I go 1-8, 2-8, 3-8, and then 4-8. So I go in that order, and then I immediately start working, and I take them out in the same order. So 1-8, 2-8, 3-8, 4-8. The idea is that by the time you've worked through all those teeth to get frozen and you're at the 4-8, right? The 1-8 has had at least 2 minutes to work right now. So you start on the 1-8. By the time you're done that, the 2-8 will be ready to go. And then by the time you're done the 2 uppers, your blocks on the lower will have kicked in by now. Always having a game plan. I think that's so important. And that's something that in dental school, we're not really taught that. Right? And that's why I see a lot of new grads, and at Dentistry Academy, we help teach surgery as well. And I see a lot of new grads, they come in with plan A and B, and it's not their fault, right? But you got to have, like I said, plan A, B, C, D, E, F, G, and more. Let's go over an example here. Let's say this tooth, tooth number 26, upper left first molar, needs to be taken out. I just took this picture off the internet, but let's say it needs to be taken out. How do we do that in dental school, other than maybe refer the patient to somebody else? But in dental school, we get them frozen, go with a periosteal in there, and then maybe get an elevator on there, but we might be a little gun shy with the elevator because we don't want to damage the adjacent teeth. So we get a forcep on there, and then, we rock it back and forth, buccolingual. And what do we know what's going to happen here, right? It's an endo-treated tooth. It's a lot more fragile. Probably going to break right there. You're going to break the crown off unintentionally. It's going to make a big noise. It's going to startle you. It's going to startle the patient. And now you have this left. And even if you have a little bit of a plan in your head of what you're going to do, this can be a little bit daunting, right? Because you look in there, it's bleeding a lot, you can't really see anything, it's far back there, and it's intimidating. So maybe you section it, and maybe you'll have to even resort to bone removal. That's not ideal, but like that's what most of us are taught, right? Average time for that is 3 hours in school, right? But it doesn't have to be that way, and it can't be that way if we're doing this in private practice. Let me show you the way that I would approach this tooth in private practice. I'm not a neurosurgeon. This is not a neurosurgery course, but I just want to give you the mindset and like an example of my mindset of how I approach things. And this can be said for anything, for a crown prep, filling. So my advice to the new grads is before you do all these procedures in private practice, make sure you have them all written down and you know the order in your head, top to bottom, before you start to do them. So for this tooth, what I would do, I mean, I know that it's going to be fragile. It's going to break easily. If I'm placing an implant there later, I'm going to section the tooth. I don't want to get it. I find trying to get it out full. It's just a little bit too unpredictable in my hands because you can break off some buccal plate. So what I'll do is I'll section it right there. I'll cut the crown off. I know that's weird because in dental school, we're taught to, if a crown comes off, we're in trouble. I just take it off right away. I take it off at that level, and I leave about a few millimeters above the gingiva to work with and to grab onto. I'll show you the reason why I do this. So most of us are using a 45-degree surgical handpiece. And if I left the crown on here, let's say, your handpiece, do you see the head of the handpiece? It's gonna bottom out right there, right? It's gonna bottom out right there. Whereas if I take it out here, if I take the crown off there, now I have plenty of access to get to my complete section here. Because if you don't section it completely and don't get all the way down to the furcation and start to twist through the elevator to try to separate your pieces, you're only going to separate crown fragments, and it's just inefficient. Get the crown off, leave a few millimeters above the gingiva, and now you can see clearly section the roots here. So I do my T-shaped section now, and I'll get my spade tip elevator and I'll put it into the PDL spaces. So now I'm not leveraging off of the other teeth. I'm leveraging off of bone. So I'll go here. I'll even go into the mesiobuccal, distal buccal line angles, and even the disopalatal, mesiopalatal line angles as well. Those are often the sweet spots to work around. I'm also prepared for this tooth to break. I know this coming into it. What if it breaks there? No problem. We'll get either our spade tip elevator or our root tip pick, and we'll tease it into the PDL space to displace that root, right? I'm also prepared that if I have to take away some, hopefully mesial, distal, or interseptal bone, minimal, I'm ready to do that as well. And buccal bone removal, it's just my absolute last resort. I don't like doing it, but that's just me. And the average time for this on my schedule is 30 to 45 minutes. It's not because I'm moving faster physically. It's just because I have the sequence in my head and I don't spend too much time on something if it's not working. I move ahead to the next step. So not properly setting up patient expectations. Let's talk about that a little bit. Sorry about the grainy picture. I got it off the internet as well. But hopefully you can see that the Carriere is here, right? And this is every day for us. Again, general practice, this is bread and butter. We see this all the time. The last thing you want to be known as is a dentist who, my tooth didn't hurt before you touched it. Now it hurts. And you got to set them up for that before, if it happens, right? So if I see this, I'll sit the patient up and I'll show it to them. I'll say, hey, do you notice right here? Those are the cavities in your tooth right there. And do you see that little kind of black spot there? That's the nerve space to your tooth. That's where all the feeling and pain comes from. Do you see how close they are right now? And I'll tell them, even if we do everything absolutely perfectly today and it goes really, really well, there's still a small chance that, it's just too close to the nerve and it will need a root canal after we work on you if it's painful and still sore, right? But I can tell you that there's a 100% chance that if we don't do anything and we leave it the way it is, it's going to get into the nerve and it will need a root canal. So that way, you just set them up, you prepare them for it. You could even, of course, document it. You can even get them to sign it if you like. And the rare occasion that happens, my patients are like, oh, yes, I remember you told me this and I know it was a risk going in and let's move ahead now. So shifting gears a little bit, let's say, you got all these advice for practice efficiency, practice, builders, practice killers, But at the end of the day, as practice owners, we are also running a business as well. We got to keep the lights on, right? And so how do we decrease overhead? There's two ways. You increase production or you decrease expenses. Those are the two ways to decrease your overhead. And let's dive in a bit. So increasing production. Highly recommend watching all of Dr. Manquek's lectures are posted on YouTube. He goes into clinical efficiency at a level that, I mean, I can't even match. So he's the guy to look for clinical efficiency there. Having multiple well-trained assistants is massive. It's really huge. And you got to be efficient with the hours at the office. Let me show you an example here. So let's say we have a practice and it's open 39 hours per week. So not a ton. The average time open per day is around 6.5 hours. So not terribly long days, right? Most people would be pretty happy with just working 6.5 hours per day, right? That's not bad. But what if we can get the annual production to about 1.65 million? It's pretty good, right? I mean, like 6.5 hours a day to that production is nice. Let's say on a typical day, you get 2 assistants, $50 an hour total that you're paying them. 2 front desks, $45 an hour total. 2 hygienists, $90 an hour total. Office manager, $35. And as you can see, these are pretty generous salaries as well. And you got a dentist working there. So your staff cost for the 6.5 hours would be $1,430. That's a lot of money, right? Like a lot of people, rightly so, would say that's a big staff cost for the day. But what if you can offset that with production? So your office production is 6,000 per day. And now if you do the overhead calculation, your staff overhead, which is normally your main costs to running an office, is 23.8%. And as we know, the industry average is 25%. So we've managed to stay under. In full disclosure, this is one of my offices. And again, this is not to brag and say, look what we're able to do. Because again, I know there are many of you even listening right now who are doing much better. But this is just to open your eyes and say, like, it's not all about cutting costs to decrease overhead. It's also about increasing efficiencies and production as well. But also being able to treat the staff well by paying them their rightful salaries. There's also another concept of maximizing the use of your facility. And an example of this would be a concept called split shifts. And I know this is kind of the way that a lot of dentists are thinking they may shift towards in post-COVID times. So in that scenario, you have dentist number 1, who let's say works 8 to 2. You can make whatever hours you want, but let's say 8 to 2. And you have dentist number 2, who's working 2 to 8. And you could even have a separate staff for them as well. So now you have dental coverage, dentist coverage, and staff coverage for 12 hours of the day, but nobody's burning out because nobody's working the 12-hour shifts. It's just a nice way of keeping everybody fresh and on top of things. And it works really well if you don't have a ton of operatories. Let's say you're a 3 or 4 op practice and in your mind, you're like, I can't produce as much because I don't have 7 ops or 10 ops. This is a great way to counteract that because you're using your facility, you're maximizing the use of it, and you can produce as much as a 7 to 10 op practice by doing this strategy. Well, let's talk a bit about decreasing expenses, right? Because that's our second way of decreasing overhead. And the main way to do that is you got to keep a close eye on your P&L or profit and loss statements, and these you get from your accountant or your bookkeeper. I get it from my bookkeeper every month, and I keep track of it. You got to keep score, right? And you categorize everything as a percentage of collections. I'll show you that soon, and you got to compare it with the industry average. Example of this is one of my practices. So here we have 2019 numbers. That's the categories. So advertising, we did 24,000 we spent, and these are our percentages of collections. And here, industry average, those are the numbers that we're comparing them to. Ideally, we want to be lower, right? These not applicables, don't worry about them because those categories all add up to another category you can't see here called discretionary expenses. Industry average for that is around 17%. And for us, we were hovering around 11%. So that's why these are all green. Green meaning we're healthy, or we're either matching it or we're under the numbers. But then you see here, this is a big red flag. So red means that we're overspending in that category in dental supplies. And you see here 9% or so compared to the industry average of 7%. Not bad, but we can work on that. If I didn't have this, I wouldn't know, right? I wouldn't know how we're doing compared to industry average, and you can't fix something unless you know that it's a problem. So how do we fix that? How am I going to fix that? Supply costs. It's pretty straightforward. I mean, I'm just going to take 5 to 7% of my previous month's collections, and I'll set that as my supply budget. Let's say, for example, January, you produce and you collect $100,000 as an office. No problem. Let's say you want to put your supply budget at 7% of collections for industry average. So you take 7% of the 100,000, so $7,000. That's your budget for the next month. So $7,000 budget, and you don't go over that. It doesn't become a shopping spree now for your assistants. So this is a dentist formulated kind of formulary for your staff to follow. You can do the same for anything, really. I mean, like you just do the same for marketing budget. Usually that's 3 to 6%, depending on how much you want to grow. It minimizes decision fatigue. I've said this before, but as a dentist, as an owner, as a multi-practice owner, or whichever you choose to be, the amount of decisions that you have to make on a daily basis in even just clinical practice, I'm not even talking about the admin side, can be pretty staggering sometimes. You have to make so many decisions. So anything to minimize these amount of decisions that you make and create predictable, sustainable systems for, like the one I told you with the supply costs and setting budgets like that. Now, I mean, they're following your kind of plan, but they don't have to ask you every single time. And that really helps. Owning multiple practices. I mean, the reason why I put a question mark is because it's not for everybody. Not everybody's going to want to do it. Not everybody's going to want to own any. And there's no problem with that. There's no right or wrong way of doing things, right? But if you're thinking about it, I say focus on a single location first. And you get that single location running extremely efficiently before you even decide to move on. And you got to ask yourself these questions here. Can it run on its own? Does it have consistent cash flow? And does it have enough cash reserves to cover 3 to 6 months of expenses? Perfect example of this is the pandemic. At that point, I had 2 offices running, 1 office about to be open. And my first location, my single location, it could run on its own. It was at the point that I didn't have to babysit it. It had very consistent cash flow every month. And it had more than enough reserves to last us 3 to 6 months of expenses. I mean, it's still floating right now. I mean, my reserves for my first office is floating that office plus the other 2 right now. And if I didn't have those reserves, I could still make it work, but it would just be, I'd be a lot more stressed out than I am right now. So this is really important to have this in place before you move forward. I put advice in quotations. Again, I'm not a financial advisor. That's what Vic Jindal's here for, right? But this is just what I live by or what I go by, and a few new things here. So pay off your line of credit as quickly as possible. Don't buy a fancy car. I've already said this, but don't buy a fancy car unless you can buy it in cash, right? Pay off your line of credit before buying a house, ideally. Buy a practice before buying a house. Well, only if you want to own a practice or house, right? But I'd say buy before, because now you're not pigeonholed into a specific location, and your practice is an asset, whereas your house is a liability, right? Because it doesn't make you money monthly, whereas a practice can be an asset that pays for your house. Really important here, same concept as I just mentioned. So after paying off your line of credit and you're debt free, set aside 3 to 6 months of expenses as like a rainy day or emergency fund. Another perfect example, COVID-19, right? And if you set aside 3 to 6 months of like an emergency or rainy day fund for yourself, times like these are not going to seem as stressful anymore because you're prepared for it and you have the finances and you don't have to go more in debt. please make sure you have a pandemic clause in your practice interruption insurance if you decide to own a practice. That's huge. Thank you so much, guys, for listening. I hope you got something out of it. If anybody wants to has any questions or wants to email me, email address is there, my LinkedIn, and also my cell number there as well. So feel free to contact me anytime. Awesome. Thanks, guys. I really appreciate it.